everyone. We are the Group 3. We will start our presentation with our case scenario. This is Mr. Khan. He is an immigrant from Iran. He has 2 daughters named Mina and Simi. His wife already passed away due to an unknown cause. Mr. Khan's health issues are hypertension, type 2 diabetes. He is also a cigarette smoker and an occasional alcohol drinker and is non-compliant to medication. As a result, Mr. Khan suffered from hemorrhagic stroke and has right-sided hemiplegia.
Mr. Khan has 2 daughters. The oldest is Mina, who lives with her own family in Iran, and the youngest is Simi, whose family lives together with
Simi is a plain housewife with triplets. Her husband works full-time as a call center agent with night shifts. She is the primary caregiver of Mr. Khan. Mr. Khan and his family lives in a 3-bedroom apartment, and only Simi's husband generates an income to provide for the whole family. Simi is having a stressful life as a housewife ever since Mr. Khan had a stroke. She has a hard time taking care of her dad and the triplets. Mr. Khan is currently having sessions with his PT. Due to his paralysis, he is fully dependent on Simi in all his needs, and this makes him feel depressed knowing that he compensates the whole family because of his condition. Simi's husband is always tired and pressured as to how to provide a good income to the family. They also don't have a quality time to spend as a family. He and Simi is also concerned about the triplet. Knowing all these facts, we will now discuss to you more information about the Khan family.
I'm part of Group 3 and I'm presenting on the realistic development of the health problem for Mr. Khan. So the realistic development problem for Mr. Khan are 1. Hypertension, type 2 diabetes, cardiac complications as a result of non-compliance to medication, increased blood sugar level, elevated blood pressure, aging, hemorrhagic stroke. So we're moving on to the settings in which the health problem for Mr. Khan became known. So the settings in which the health problem became known with Mr. Khan is the health problem for Mr. Khan became known when he had the hemorrhagic attack on a sunny afternoon. While he was working, he has a comorbidity like hypertension and type 2 diabetes. As a result of the hemorrhagic attack, laboratory results and assessment shows the presence of cerebral blood clots that requires the patient to undergo the surgery. So now moving on to the risk factors for Mr. Khan health problem. So 1 is cigarette smoker, type 2, he had type 2 diabetes, he wasn't exercising, he wasn't complying with the medication, he had a poor eating habit, he was mostly eating carbs and meat, and occasionally he would drink. He also had hypertension, he was stressed, and he was aging too. So now we're looking at the impacts of the health problem of Mr. Khan on his family. And the impacts are physical distress on the family. His condition or his disease brought financial problem to the family. It also brought impaired social activity with his daughter, emotional dilemma on the family. It also brought mental issues on the husband, which is the son-in-law. It also brought stress to the family and also nutritional and personal needs for the family.
That's about the family structural characteristic. The Khan family is an extended type of family. There are 6 members in the family, including Mr. Khan himself, daughter Simi, Simi's husband, and the triplets. There are 5 males in the family. Mr. Khan is the first one. He is 65 years old. And the next one is Simi's husband, who is 32 years old, and the triplets is 3 years old. Simi is a female and she is 30 years old. They have been here in Canada since 2004. They are Persians and their religion is Islam. Occupations of family members or grade school. Mr. Khan is a retired mechanical operator, works part-time before he had a stroke, and Simi's husband works full-time in a call center. They are low-income family. Only one member in the family generates the income. The current health status of each family member: Mr. Khan has right-sided hemiplegia, impaired activities of daily living, and is dependent on most of his needs. Simi, her daughter, is depressed and mentally unfocused, physically exhausted, being the primary caregiver and a mother to triplets at the same time. The triplets are healthy and active. They have no health issues. Simi's husband have lack of sleep and stress with family issues as well. The environment the family live in is a 3-bedroom apartment. It is a peaceful area and away from the city. Apartment is not well cleaned because Simi don't have much time to do the household chores plus having a triplet. Health problem experienced by one of the family members. So Mr. Khan, he is a hemorrhagic stroke survivor, had undergone brain surgery. He has impaired speech and with right-sided paralysis. His upper extremities are getting better, but with weakness on his right arm. He needs continuous physical rehabilitation. The primary focus of care is Mr. Khan, and the secondary focus of care is Simi and his husband. And then, besides from that, their mental health is Simi is depressed and mentally unfocused. He is always exhausted, and Simi's husband is physically tired, lack of sleep, mentally unstable, and stressed, dealing with a lot of family issues, including financial, family support, and services.
Hi everyone, I'm Eugene Gamboa and I'm going to discuss what are the impact of health problem on family structure and interrelationship among family members. Impact of the health problem on family structure. Physical well-being. Physical distress includes feeling unhealthy, tired, run down, having no energy, headaches and stomach aches, feeling faint, having trouble breathing, being in pain, having difficulty with activities such as walking, lifting, carrying, bending, and so on. Based on our family story, we can say that Mr. Khan is a physical distress since he cannot totally manage to take care of himself due to hemorrhagic stroke that left him with a right-sided hemiplegia. Emotional well-being. It consists of feeling happy, hopeful, and energetic with a zest for life. Psychological distress includes moods of depression or anxiety, the physiological symptoms associated with these moods. Based on our family story, Simi and her husband feel depressed because of their situation of their family. Economic well-being. The chronic strain of struggling to pay the bills and to feed and clothe the children takes a toll, making parents feel run down, hopeless, and worried. Based on our family story, since Mr. Khan cannot work anymore due to his condition, their income is not enough to provide their family needs. Women's employment. Most research finds that employed women have less depression, anxiety, and the other forms of psychological distress than do housewives. Based on our family story, Simi feel helpless and wanted to work to help with their financial needs. The problem is no one will take care of her father and her children, and she doesn't want to run from her responsibility as daughter and mother as well. Low family income. Low family income is obviously the major cause of economic hardship, but the translation is not one-to-one. At the same income level, those who are poorly educated feel greater hardship than well-educated. Based on our family story, Simi's husband had to shoulder all their financial needs, which make for him is too stressful as well. The impact of health problem in the interrelationship among the family members. The quality of family relationship, including social support and strain, can influence well-being through psychosocial, behavioral, and physiological pathways. Stressor and social supports are core component of stress process theory. As children and parents, the nature of the parent-child relationship often changes, such that adult children may take on caregiving role for their older parents. Adult children often experience competing pressure of employment, taking care of their own children and providing care for older parents. Mothers often report greater parental pressure than father, such as more obligation to be there for their children.
Okay, so we're gonna look at ways to demonstrate manners or respect to the family. So according to Robinson et al. 2018, effective communication combines a set of 4 skills, and these are engaged listening, nonverbal communication, managing stress in the moment, and 4, asserting yourself in a respectful way. So introducing yourself to the patient and family every time, since some families are working with many different teams. They see residents, students, physicians, nurses, and more. So you smile and greet the family. For example, hi, Mr. Khan, a pleasant morning. How are you doing today? Also become an engaged listener. You pause for a while and listen to what the patient or the family is talking, making eye contact when talking to the family, nodding your head to confirm agreement. You can also restate what they have said if you want to confirm something, and encourage the speaker to continue with small verbal comments like yes or using simple words the family can understand, not medical jargons or medical terms. This means recognizing their psychosocial, educational, and cultural background. Explaining what's going to happen and asking permission from the patient and family before performing an exam is an equal part of proper way of demonstrating manners. Be assertive, direct, assertive. Expression makes for clear communication and can help boost your self-esteem and decision making. Being assertive means expressing your thoughts, feelings, and needs in an open and honest way, while standing up for yourself and respecting others. It does not mean being hostile, aggressive, or demeaning. Effective communication is also about understanding the other person, not about winning an argument or forcing your opinions on others, according to Robinson et al. 2018. The 5 therapeutic questions you would ask and engage the family in. So the 5 therapeutic questions are 1. For example, Mr. Khan, from our conversation, I do understand how frustrating this condition can be to you and your family. So to what extent do you want others to help you and your family with this situation or concern? You can also ask Mr. Khan, I understand you and your family are having a hard time adjusting to your life situation right now. How do you feel this current situation or concern would affect you and your family's future? So we're moving on to the psychosocial considerations that are important to examine to Mr. Khan's family and the difficulty of challenges the family may be facing in this situation. So these are 1, the impact of Mr. Khan's illness on the routine or daily life of the family and the relationship between the family members. 2, strengths and coping strategies for the family in the new life adjustment. 3, fear and concern of Mr. Khan's family. 4, any communication and information need for the family. 5, psychological issues and support need. 6, experience and comfort level with the health care system. 6, financial needs and transportational needs. And lastly, housing and living arrangements and childcare needs.
Everybody, I'll be discussing about the difficulties or challenges the Khan family may be facing in this situation. Mr. Khan's family is facing extreme stress, helplessness, and poverty, which make their family to be traumatized. Since the family is struggling with upsetting emotions, anxiety, disconnected, and mistrust that won't go away, they are most likely to develop post-traumatic stress disorder. The symptoms of stress disorder can have a negative impact on mental health, physical health, work, and relationships. Problems at work and in relationships. People with stress miss more days at work, work less efficiently, face difficulties in concentrating, and problems in sleeping. They find hard to pay attention at work, stay organized, or make it to work on time. Simi's husband has a risk of poor job performance due to full-time night job and stressful home environment. People with stress disorder can have problems in their marriages. Caring for and living with someone with a chronic disease, financial challenges, loss of intimacy creates a negative impact on relationships. Simi and husband are at a risk of having poor relationship due to stress of poor income, managing Mr. Khan's illness, and rearing triplets. Social isolation is a common problem with stress disorder, which makes it hard to create or maintain relationships and may avoid social situations. Mr. Khan's family is at a risk of being isolated from the Muslim community, as evidenced in the story that they have been adapting to the Canadian culture and is not practicing their religious practices as Muslims anymore. Mental health problems. People with stress disorder are at much greater risk of developing a number of mental health disorders, including anxiety disorders, depression, bipolar disorders, eating disorders, substance use disorders, suicidal attempt, and deliberate self-harm. People who have medical conditions such as heart disease, chronic pain, or cancer are more vulnerable to develop stress disorders in response to a traumatic event. Mr. Khan's age, medical conditions like hypertension, diabetes, smoking, and alcohol use, combined with a stressful environment, make him riskier to develop mental health illnesses. Simi, being the caretaker of Mr. Khan and triplets, is overstressed and is at the peak to get mental issues. Simi's husband, being the only breadwinner of the family, working full-time, sleepless nights, trying to meet the expenses of the family, also stands forward to develop mental stress. Physical health problems. People with stress disorder are more likely to develop a number of physical health problems. It is evidenced in our story that Mr. Khan's family has increased risk for physical health problems due to physical and emotional strain. Simi is stressed physically and mentally, taking care of her father, husband, and triplets. People with stress disorder may engage in alcohol and drug use. The hyperarousal symptoms also put someone in a constant state of stress and anxiety, thereby leading to physical health problems and illnesses. Mr. Khan's age, poor prognosis, and alcohol use put strain and stress on his body, making him vulnerable to be affected with physical health issues. Stress disorder also raises risks for unhealthy behaviors like smoking, lack of exercise, and alcohol use, which may further increase the possibility of physical health problems. Mr. Khan is a smoker, alcohol drinker, non-compliant, and lack exercise. He is more likely to suffer from more physical illnesses. Emotional aspects of parents. Lack of parents' attention, especially in early childhood years, could negatively impact the child's personality and therefore their future in the life ahead. Poverty and economic instability create stress in parents and hinders them from performing their parental duties with full attention, thereby leading to dysfunction of the family. Simi's husband being so much involved in maintaining financial stability of the family and Simi being very busy with rearing of triplets and caring of Mr. Khan developed stress and depression. Their busy, stressful life routines and tight schedule prevents them from fulfilling parental responsibilities in its perfection. Spiritual impact on family. Family suffering from trauma and stress experiences positive social impact while participating in religious organizations. People who participate in faith communities and organizations do better in school and job. A higher level of spirituality uplifts different depressed families and improves relationships within the family, improves parental involvement, and reduces parental stress. Mr. Khan's family, being isolated from the religious Muslim community, lacks the positive support and grants entitled to be received from the religious organization.
Tools that can use to engage and support the family. First is Family Genogram. This tool will help us know our priorities in solving the family issues and factors that contributes to their health. Genograms are often used by counselors and therapists with an interest in what's called family system theory. Family Echo Map is a visual tool that many social workers use with families and individuals as a participatory way to involve clients in describing and organizing the various elements impacting their lives. Family Assessment and Intervention Model. In this model, families are subject to tension when stressed. The family's reaction depends the stressors, penetrates the family unit, and how capable the family is adapting to maintain its stability. The family reasoning web is an organizational tool to help analyze the family story by clustering individual pieces of data into family categories. This systematic approach to collecting and analyzing information helps structure the information collection process to ensure the inclusion of important pieces of information. On next slide, we're going to show you what are the Khan family echo map and the family genogram. Priorities for the family. First priority is promoting healthy lifestyle to all members of the family. Compliance medication is also an important priority to eliminate or lessen the risk of the stroke to happen again. Research says that those people who have a history of stroke has high chance of getting the attack again in the first year. That is why eliminating the risk for having stroke is very important. Since Mr. Khan has a history of being a cigarette smoker and an occasional drinker, family nurse should help the client practice and achieve a healthy lifestyle to reduce the risk of his condition. Eliminating or decreasing the stress and guiding or assisting them in achieving the stability emotionally and their socioeconomic status. Are anticipated periods of unusual demand on the individual or family in terms of adjustment resources. Since Mr. Khan is not capable to work anymore due to his condition and he became dependent with most of his personal needs, it is a huge adjustment for his family to cater everything all the same time. Simi, Mr. Khan's daughter, struggles to fit her time with taking care of her kids who are triplets and to take care of her husband who works night shifts. And lastly, lack of family resources or lack of income. This is a priority because this life situation causes the family a lot of health issue related effects, not only physically but mentally as well. In addition to that, they are also low-income families, so financial aspect is also a huge problem to them.
Now I'm going to discuss about the family nursing interventions. The first one is educate the family about the importance of compliance in taking medication of the patient, participating in the plan of care to avoid future health complications. The patient should have an active role in the plan of care and lifestyle modifications to avoid the risk of possible stroke again. People who have had stroke have increased risk for another stroke, especially during the first year after the original stroke. The risk for another stroke goes up with older age, high blood pressure, high cholesterol, diabetes, obesity, having a TIA or previous heart attack, heart disease, cigarette smoking, heavy alcohol use, and drug abuse. The next one is provide social and financial support to the family by referring them to the community care centers or referral to support programs from the hospital or outpatient programs that offer free services after patient discharge. Third is coordinate patient care and assessment with the interprofessional team to determine and assess aspects of care that the patient and the family needs. Likewise, help the family develop a family plan to achieve and meet the family and the patient's overall healthcare needs. Nursing should not only focus in one area of care but should provide holistic care to the family. Mr. Khan, who has physical immobility, needs an occupational therapist to assess and to implement care to maximize his capabilities as well. The next one is involve the patient and the family in the plan of care and rehabilitation programs. So I have here the list of professionals that are recommended as part of the team for providing a holistic plan of care. So we have the physician who is in charge of Mr. Khan's recovery, rehabilitation nurse, physical therapist, rehabilitation nurse, occupational therapist, speech language pathologist, social worker, psychologist for their mental health, therapeutic recreation specialists, and other professionals. This includes urologists that may help him with Mr. Khan about his bladder problems, other physician specialists that may help them with medical or emotional problems, dietitians that can make sure that the patient and the family have healthy diet during the rehabilitation and recovery.